chest cavity, commonly in the lungs, but it doesn't have to be in the lungs. It could kind of just be in the chest cavity, like the mediastinum. It could be a thymic tumor, but most commonly it's a pulmonary neoplasm, or even it's been associated with like pulmonary inflammation, like granulomatous pneumonia. So yeah, so that's a characteristic one. And also you can have hematologic and vascular changes. I'm trying to think of an example. Tumors that secrete estrogen can cause aplastic anemia. So that's an example. Okay. Just some same thing we just talked about. Some characteristic perineoplastic syndromes are hematopoietic effects, endocrinopathies, and osseous changes. Any questions? Okay. I thought I had my references down here. I got this offline. This is for human medicine, but it still applies to veterinary medicine. So Cushing syndrome, cancers of the lung, sometimes pancreatic cancer, neural tumors can secrete an ACTH-like substance. Hypercalcemia. The two biggies for animals is the, what do we say the first day? Or the first while ago? The anal gland adenocarcinoma, or anal sac epithelium. Okay, don't confuse that with perianal gland. It's anal gland. And also, I mentioned something else, I think. Also T-cell lymphoma. Maybe I didn't say that. Those are the two biggies for hypercalcemia, but there are others. And in human medicine, these were the ones listed in this graph. Some cells produce vitamin D, which of course can also cause a hypercalcemia. One of the characteristic things I think about when I see that, and speaking on veterinary medicine, it's not so much a tumor, but it's a granulomatous inflammatory response. Secretes vitamin D, can cause hypercalcemia, and causes mineralization of your endocardium and your aorta. So I'm going to see if I can guide you to what that is. Do you know what causes granulomatous inflammation in the intestine and causes a very thickened wall in bovine? The cause? Jaundice disease? Yes, ma'am. Jaundice disease. Yep. And what is the etiology of jaundice disease? Mycobacterium, avium, subspecies, paratuberculosis. So MAP. Okay, so Mycobacterium, avium, subspecies, paratuberculosis. So that's something which isn't a neoplasm, but is causing a granulomatous inflammatory response, which is secreting a vitamin D substance, and you can kind of get the same thing with that. Polycythemia. Some tumors produce erythropoietin, and that can cause excessive red blood cell production. This is a very classic. So know that thymoma causes myasthenia gravis. Very, very classic. You should definitely know that one. And they kind of don't know why. Here we talked about the hypertrophic osteoarthropathy, or sometimes it's just written osteopathy. And this is due to something in the chest cavity, commonly the lung. And you can have non-bacterial thrombotic endocarditis due to hypercoagulability of the blood. Okay, so this was a very old picture, but you can still see it. An example of hypertrophic osteoarthropathy, you get proliferation of the bone, so like severe exostoses of the bone. Usually it's all four limbs affected. Okay, it's not a tumor, and once you remove the pulmonary issue, it goes away, and it can be painful. Okay. All right. So for diagnosis, again, a lot of self-explanatory stuff, but the history is important. Physical exam, blood work, radiographs, cytology. Cytology can be I talked about that already though, but that's always good to do, and it's something y'all can do as clinicians yourselves. Biopsies, usually the gold standard for things, because you can actually not just see the cells, but see the architecture within the tissue, you kind of see the big picture, and chemical analysis. Biopsy. So with biopsy, sometimes you look under the microscope and you really are not sure. So you can do special stains or immunohistochemistry. We do it all the time. Especially when tumors are poorly differentiated, it can be very hard sometimes, or impossible to tell just by looking under the microscope. You can do in situ hybridization, cytology, flow cytometry, and the ultimate diagnostic tool is necropsy. So we don't want to do that unless we must. Yes.
What's a cytometry?
Flow cytometry is something they do in ClinPath, and it's a measurement of like cell size to determine what the cells are. It's like an analytical. You put it in a machine and it does this printout, and it's basically the cell sizes. Any other questions? Okay, so grading and staging of cancer, very important concept again. So these two tools, staging is clinical, so that's what you do when you see this animal and figure out where the tumor is, how big it is, did it spread somewhere. Grading is what we do as pathologists. We look under the microscope and grade the tumor cells themselves. Okay, but both of these tools are useful as prognostic indicators on what's going to happen with this animal, with this tumor. So these quantify the probable clinical aggressiveness of a given neoplasm. And it expresses the apparent extent and spread in the individual patient. Okay. Staging is more valuable in the clinical setting than grading, because sometimes you may have a high grade, but let's say it was only 1 centimeter and it didn't go anywhere, it hadn't gone to the lymph nodes. So even though it's a high grade, probably if you remove it all, you'll probably be okay. So you have to use everything in conjunction. You don't want to euthanize the animal because it had a high grade mammary carcinoma, but it hadn't gone anywhere yet. You caught it early, so. Okay. All right, so grading. So grading estimates the aggressiveness or level of malignancy based upon the cytological differentiation of the tumor cells, which includes the number of mitoses. Okay? So you look at the cells, do they look nice and friendly? Then it's a low grade. Do they look very angry and aggressive? Then it's a high grade. And a correlation between histologic grading and biological behavior is less than perfect. Sometimes they don't do what they look like they're going to do, or they look like they're not going to do anything, and then 2 months later the animal, has spread to the liver or something. So this is just an example of a grading scheme, like 1 through 4, but it varies. It varies based on the tumor you're looking at. So it's no like set rule. Every tumor has a certain grade. Some tumors are low grade and high grade. They don't have grading numbers. The grade as it increases reflects increasing neoplasia of the tumor cells. And like I said, criteria for grading varies with the tumor type. So that's great. So that's all under the microscope. So staging is what the clinician does based on the presence, the size. So it's based on the size of the cell, the tumor, not the cell, the tumor, which is T. So you have a TNM staging system used universally, human medicine, animal medicine. So T is for the tumor size. N is for the lymph node involvement. Has it gone to the regional lymph node? And M is for metastasis beyond the original site of the tumor. Okay, so the TNM system. Again, this is an example. Every tumor does not have this staging pattern, but this is one of the kind of common ones. And you'll see, like if you go online or look at different references, some only go to 3, some go, to N2. Yes, sir.
In terms of your lymph node involvement, is it the different stages to see how many lymph nodes are involved, or the more distal lymph node, higher grade?
It's how many.
Okay.
Mm-hmm. And usually it's going to be the first one nearest first, but it's based on number.
Okay.
Okay. And you can either say M0, not present, distant metastasis is not present, or M1, no matter where it is. It's gone somewhere, so this is always not good. Any questions on that? Yes.
So, when we would be doing it in the clinics, we'd be, going based off what we see from the animal and like what the radiographs would show us. But then down in pathology, you do like the histopathology and everything like that.
So you do it based on what you see with your diagnostic tools, which include us. So, you know, you may not be able to tell just by feeling the animal that it's in the lymph nodes, or doing a radiograph so you can tell that it's in the lymph nodes, or ultrasound. So you can do a biopsy and submit that to me, and then I'll tell you, yes, it's in the lymph nodes, or no, it's not in the section that you submitted. So you use those things as your tools to help you stage. You can't do it all. I mean, when I say clinical, you can't do it all just by yourself. So it's clinically with your diagnostic tools. And metastasis, you're probably going to be able to see with ultrasound or radiographs. Or sometimes you don't. You can't. Any other questions? All right, so therapies, and this is the last part of this. So you can either have conventional therapies or non-conventional. Non-conventional is a more holistic approach, or we'll go through some of those. So conventional therapy is kind of what we train y'all to do. Surgery, chemotherapy, radiation therapy. You can do kind of hormone modulation therapy and immunotherapy. Okay. Then your unconventional treatments, or I should say non-conventional, is special diets, acupuncture, essential oils, massage. I've been massaging my cat. I don't know if it's like really working, or if she just likes it, or if it's in my mind. But it seems like she's very overweight. But and she limps, and I'm pretty sure she probably has degenerative joint disease, because that's something overweight older cats get. But yeah, she'll like come up because she wants to massage. I think this helps her. So yes, unconventional treatments are not bad. And so y'all know Dionysia. So she's the like holistic person. But there was also a student who graduated probably in 2015, maybe a couple years ago, Sharon Weatherspoon. Y'all know her, anybody? Some people. Well, she actually went to, there's a homeopathic like school training that she completed as a vet student. You had to go like a week at a time for multiple weeks, and then some other training. So there are like different training options out there if you're into that type of thing. And I think Dionysia said she went to the Chi
In China, right?
Institute in China, yeah. So that's pretty cool stuff. All right, are there any questions? Okay, so we'll take a 5-minute break, and then we'll resume with the lab, okay? Or do y'all just want to keep going?
Wait, a 5-minute break? Why 5 minutes?
Who wants to keep going, please raise your hand. So we'll take a 5-minute break.
5 or 10?
It is 1:47, so it'll start back at 1:52. Oh, and I put the updated, like I fixed this up during the time. So this has been changed from what it was initially.
I'm not going to.
Huh? I don't know who's talking. Oh, what'd you say?
This PowerPoint is a new one?
Yeah.
Okay.
I just removed the other one and put this one up.
Okay, thank you.
Oh, there's something else. Oh, well, I'll see when you come back.
Right in there, you might have second. I'll try and go there, because I don't know where I'm
I'm sorry.
Huh?
right after class.
Wow, you're just gonna cheat on me like that. You're gonna trade me with someone else. But she can come over if she wants to. I can understand like James popular, so everyone wants to get cheating. I don't know. In the back.
They're well. Have to fight. Study with Shannon. Alright, let me go.
That right there is spicy. Especially when they're green. That was good. He has no real cream. He was just like that.
Not today. I spent
Like my grandmother's name so
already back.
So it's not healthy, I'm not a freak.
Like,
Okay, over.
she's like, I've seen you before.
they know. She was
Well, actually, you didn't have to try now.
Yeah, he was such a
I'd rather just go home and see what I can.
Don't do this yet.
I know. You don't really have to take someone else, so I'm taking it as I don't have to stay with her.
That's definitely American model. It's like, that's the true definition of what they really is. They really are.
It must be true because in Mexico they even have like the
They work.
Dolphin.
I'm telling you, man, dudes were, they don't allow to high school. We were not virgins anymore.
I've never been on a band bus.
Listen.
Drumline bus.
No.
First of all, the drumline, what was the drumline doing? When I drumline was our guys. First of all, I found out a lot of things about life in that sense from that. It was intense.
Never done like hand checks.
I was there bad.
Somebody said hand checks, you gotta put your hand in the air.
Oh Lord. There was no way I could have saved you. I would have just laughed first, then say, "Are you okay?" and then laugh again.
First time I ever got my prom group. And they were and that was my first time. I was like, I don't know what's happening. People got me down in that river house. In the river house. We're out to Colorado. Because they're big.
Yes.